Hello and welcome, everyone. My name is Alexandra Thomasen. I'm a first-year DAT student at Indiana State University. So today I will be doing my patient education video on a patient who just sustained a grade 1 medial ankle sprain. He is an 8th grade basketball player and he has never hurt his ankle before. So I'll kind of be walking through the steps of the healing phase and taking it from there. So, from my recent findings, I do believe you sustained a grade 1 medial ankle sprain. So, kind of what that means, we will start at the lower leg to explain some of the anatomy and where those ligaments are. So, you have two bones in your lower leg. One is called the fibula and one is the tibia. So we'll kind of shift our focus to the tibia, which is where at the very bottom above your foot, you have that small ball on the inside of your ankle. That's called your medial malleolus. So about four ligaments, we group them together to call them the deltoid ligament complex, come off of that bone structure right there, and they all span out and insert on different bones in your foot. So when you have an eversion mechanism or the same exact way you kind of hurt your ankle, those ligaments become overstretched. And what a grade 1 ankle sprain is, there's no tearing of the ligaments, they're just have become overstretched. And so they're not in their proper alignment. The purpose of these ligaments is to provide stabilization and prevent excessive motion at that ankle joint. So in total, we have three healing phases. The first is what you're experiencing now, which is the inflammatory phase, where we see this a bunch of swelling. We have the pain, the heat to touch, and the redness. So swelling is completely normal because we want the new red blood cells, white blood cells, and chemical agents to all rush to the area and kind of clean up and repair the tissue that has been kind of damaged, which can take place for about 24 to 72 hours. Then we have the formation of new blood vessels. So oxygen is delivered to the damaged tissue, which happens in about 4 to 6 days. And the new collagen, so what the ligaments are made up of, is the collagen, which is a kind of connective tissue. And when we have new oxygen to the area, the collagen forms. And so basically that makes up for how elastic the ligaments are and how much movement they really can allow. Then the final phase is called the remodeling stage, where the collagen fibers become thicker, stronger, and they kind of prevent that motion now from happening. So a lot of the blood vessels and inflammatory cells that we saw previously in the first stage of healing disappear from injury. Even though your pain decreases and eventually becomes gone in a short period of time, tissue remodeling can take place from months up to a year or more. So you're still at risk of re-injury until the ligament is completely healed. Um, Typically, grade 1 strains can heal in 7 to 10 days, where you have no pain and your function returns almost fully. So it's really important for you to ice at home, rest, elevate to kind of push that swelling back out of the area, as well as use compression like an ACE bandage as well. It's also advised you can take NSAIDs such as ibuprofen to help with the pain, but taking ibuprofen past that 3-day window kind of serves no purpose and can actually set us back, research shows. So typically, it's important to kind of get some early movement going so we're not totally immobilized, so we lose all range of motion and all function. So I would really like to see you back here tomorrow so we can start some therapeutic exercises and some light ankle ranges of motion movements kind of to get you going again. It might not be a bad thing to purchase an ankle brace to prevent re-injury in the future because, as I said, it may take up to a year for the ligament to become as good as new, and we want to protect the ankle joint from injury during that time. So then I would ask the patient if they have any questions. I'd be happy to answer those, and then I would see them tomorrow, do a reevaluation, and kind of take it from there. It's easier to kind of tell them at this middle school age is to tell them what we're going to do right now, and then they can focus on that instead of we're not going to look like weeks and weeks ahead because it's just hard for them to wrap their head around, I found. So this would be my best way of educating the patient using a kind of diagram or internet resource to show them an image. Thinking about possible patient questions, I know that when can I return to sport or when can I return to practice is a big one for athletes. So it basically has to do with my reevaluation the following day and seeing are they functional and what is their pain level at. After running them through, functional testing, jogging, sprinting, dynamic warm up, and seeing where they're at. And that A determines if they can practice at all. B, can they practice with limitations and restrictions? Or can I just return them safely and confidently where they're just as tolerated for the day? And I'd ask them, okay, what's your pain level currently? And say, don't let it get above this specific number. And if it does, stop immediately, come see me, and we'll ice you down for the rest of practice. It's more about taking care of your body at this age where I'm in the middle school setting versus, okay, can you play today so you can practice for your game tomorrow? Like, we need to prioritize our health. So that's kind of what I'd explain to them. Another big question I see is being medication related. And at this age, I feel like it'd be information overload for me to get into specifically Tylenol versus ibuprofen versus Motrin. It's just a lot. So if they say, okay, ask me anything medication related, studies have shown that NSAIDs for a long period of time during an acute inflammatory phase will really set you back and have detriments to healing because you're masking the pain. And that's kind of your limitation can be pain related. So first thing that I'd kind of tell them is if you're not in an immense amount of pain and you feel like you don't need medication, don't take it. It's not necessary. However, if you can't get through the night or if it's, really, really bothering you to the point that you can't sleep, sure, you can take NSAIDs, but we're limiting our NSAIDs to like 1 to 3 days max, because after that, we don't want it to affect us long term. So thank you so much for watching this video.